Welcome to the October 16th show of the April 4th Coalition. We're missing Elizabeth. She usually does our introduction, so I'll fumble through. Unfortunately, Liz's sister, Deborah A. Callahan, passed away last week, and our thoughts and prayers go out to Liz and her family during this time of their loss. So the April 4th Coalition mission statement is, we are for workers' rights and collective bargaining rights, and we're against tax breaks for the rich and corporations who ship our jobs overseas. We always read the Article 23 of the Universal Declaration of Human Rights. Article 1, everyone has the right to work, to free choice of employment, to just and favorable conditions of work, and protection against unemployment. Number 2, everyone, without any discrimination, has the right to equal pay for equal work. Number 3, everyone who works has the right to just and favorable remuneration, ensuring for himself or herself and his family or her family an existence worthy of human dignity, and supplemented, if necessary, by other means of social protection. Number 4, Mike?
Number 4, everyone has the right to form and join trade unions for the protections of his interests, his or her interests.
Thank you very much. We're happy to have Michael and Susan here with us in the studio. We're going to first talk about, or we're going to show a video by Bernie Sanders that was put out about 14 days ago, between 12 and 14 days ago, about his issues of health care. He wanted to give us a report on that news of what's happening in the Senate on health care. So let's listen to that.
Hey everybody, thanks very much for joining me. Let me give you a brief update of some of what's going on in Washington from my perspective. You all know that Congress miraculously avoided a government shutdown despite the best wishes of some right-wing extremists who just don't believe in government. So we survived that bullet. We will see what happens in a month and a half. Clearly there are enormous issues facing the country that we are not yet dealing with: income and wealth inequality, a corrupt political system, the fact that 60% of our people are living paycheck to paycheck, the fact that we have a child care crisis now, which is only going to get worse, and needless to say, we're dealing with the existential threat of climate change. Some of the issues that we are not dealing with, or some of our right-wing extremists want to shut down the government. But in the midst of all of that, I wanted to say a few words as chairman of the U.S. Senate Committee on Health, Education, Labor, and Pensions about the health care situation in America. And as I think all of you know, our healthcare system is basically broken. It is dysfunctional, and in fact, it's getting worse every single day. We spend, as a nation, almost twice as much per capita on healthcare as do the people of any other country. $13,000 for every man, woman, and child. That's unsustainable and quite unbelievable, and it is over 18% of our GDP. Yet, despite that huge expenditure, we remain the only major country not to guarantee health care to all as a human right, leaving 85 million people uninsured or underinsured. And it is my view, as I think all of you know, that I believe we should move toward a Medicare for all single-payer program, guaranteeing health care to every man, woman, child in this country as a human right. But we are not there now. 0 Republicans will support that, and probably half of Democrats won't support it as well. So that fight continues. But I'm not going to tell you that we're going to pass Medicare for all tomorrow. We are not. Despite our huge healthcare expenditures, one of the other factors that is really quite incredible is our life expectancy is actually getting lower. And incredibly, not only do we trail behind many other countries in how long we live, the gap between the rich and working families is now 10 years. In other words, if you are poor, if you're a working class person, on average, you're going to live 10 years less than people who have a lot of money. That is immoral. It is unacceptable. That is the reality today. In terms of prescription drugs, as I think you all know, we pay by far the highest prices in the world for prescription drugs. And every year the pharmaceutical industry makes huge profits, pay their CEOs exorbitant compensation packages. And what is really nerve-wracking for me as the chairman of the committee is that many of the new drugs coming onto the market for cancer and for other diseases now cost over $200,000 a treatment. Yup, you heard that right. $200,000 a treatment. And as bad, and this is the area that I'm working on right now, as bad as our overall healthcare system is, our primary care system is even worse. Today, despite this huge expenditure of money, we have major shortages of doctors, nurses, mental health providers, dentists, and pharmacists. And those shortages will only grow as a result of the COVID burnout that many providers experienced and the aging of our healthcare workforce. And as a result of that, tens of millions of Americans, even those with decent health insurance, cannot find the medical care they need on a timely basis. And some Americans, gotta wait months to see a doctor. Others living in rural areas have to travel incredibly long distances to find a doctor. This is the richest country in the history of the world. That's our healthcare system. So what are we trying to do about that? While we continue the fight for Medicare for all and a revamping of this entire broken system designed just to enrich the insurance companies and the drug companies, while we continue to work on that, right now, what I am focusing on as chairman of the Health Education and Labor Committee is primary care. Now, why am I doing that? A, because I can put together some bipartisan support on that. We just passed recently a major bill with every Democrat on the committee voting for it and 3 Republicans voting for it. That's a kind of big deal. And what does this bill do? What it says is that it is crazy that we don't have enough doctors and nurses and mental health providers. So we are putting a significant amount of money into a program called the National Health Service Corps, which will get young doctors and nurses and dentists to underserved areas by forgiving their debt. So we're going to grow the number of doctors and nurses and get them to the places that we need. We are also expanding a program called the Teaching Health Center Program, which allows residents, medical residents, to get their training in other than big urban hospital facilities. They can now train in community health centers, train at smaller hospitals, and get more involved in rural and urban health care and in primary care in general. And maybe most importantly, what we're doing here is making a 75% increase in funding, 75% increase over a 3-year period for community health centers. And what is a community health center? Well, community health centers exist in every state in the country. They provide affordable, depending on your income, affordable health care, dental care, mental health counseling, and lower cost prescription drugs. Over 30 million people around the country now utilize community health centers. This legislation would significantly expand that number. So we have a major healthcare crisis. The entire system needs to be reformed. We don't have the votes to do that right now in Congress. The power of the insurance companies and the drug companies is just so great, so intimidating to many members of Congress, they can't stand up to them. That's just the fact. But what we can do right now is make a significant step forward in primary health care. And when you do that, by the way, you actually save money in the healthcare system. Because if people go to a doctor when they are sick, rather than getting sicker and sicker and ending up in an emergency room, which is very expensive, or a hospital, which is even more expensive, you save money. Keeping people healthy, disease prevention, treating kids in schools, which is what this bill does, saves money. So I wanted to give you an update of where we're at. We got the bill out of the Senate Health Education Labor Committee on a bipartisan basis. We're going to try to get it to the floor as soon as we can. And if we can pass this, it will not deal by any means with all of our healthcare problems. but it'll be a significant step forward in providing health care to more people and lowering the cost of health care in America. Okay, thank you very much. Take care.
Thank you, Bernie.
That was
Any
great.
reaction, Susan, to that video?
Yes, I think one thing that really strikes a core in me is prescription drugs. I go into catastrophic with prescription drugs, I would say about maybe 3 or 4 months into the year. And if I didn't have insurance of any sort, I have no idea how I would even try to pay for any of my medications. I mean, the list is so long. And as you get older, of course, but my prescriptions were extremely expensive, thousands of dollars for one prescription. So that's one of the things that really, and of course there were many more things, but that's the one thing that really hit my core.
How about you, Michael?
Well, it's good. It proves the same thing that we've been talking about right now. Is that it seems like everything is not quite on an equal basis. If you got it, you get to keep it. If you haven't got it, we're not going to give it to you. You have to spend more money on you and take it from the people who have the money. So some of healthcare, I think you must not only talk about providing good care for people. Where is it? How is it? And what can you do to get to it? A lot of people don't have transportation. I mean, they have to find a ride. They got, just when they do things, they got to go all the way. But as soon as they stop at a stopping point, instead of taking care of all the people, well, we take care of about 50% of them. That's a hold.
Yeah, 85 million people, he said in that. 85 million people are underinsured or uninsured. 85 million, that's a lot. But we spend $13,000 per person, twice as much as any other country, but we're not getting the universal coverage. I know he talked about Medicare for All, and I just want to make a little segue because one of our friends, John Weissman, with Jobs with Justice, who helped us become a part of that institution, Jobs with Justice, he's being recognized this Saturday in Holyoke by the Carlos Vega Fund for Social Justice. The Carlos Vega Fund for Social Justice will honor John Weissman as the 2023 Social Justice Awardee at its annual fall event this Saturday, October 21st from 2 to 5 p.m. in Holyoke. Weissman is a well-known community activist and organizer. He's devoted his life to fighting for social justice, from serving as union president of the National Association of Letter Carriers Branch 46, which is Springfield, Western Massachusetts area, excluding Berkshire County, to working with Jobs with Justice. His current efforts is focusing on passing a bill in Massachusetts to establish a single-payer health care system, Medicare for All. Weissman worked closely on many grassroots organizations' activities with Carlos Vega. So Carlos Vega was an advocate for those experiencing hardship because of poverty, homelessness, or lack of education and job opportunities, as well as unfair treatment on racism and intolerance. His organizing work on behalf of the people in Holyoke spanned over 4 decades. He died in 2011. So I'm going to go down there because I want to be part of that. My wife and I are going to go, and my sister and her husband live in Holyoke and have worked with Carlos before, so we're going to honor John for that. And he's working hard for Medicare for All in Massachusetts, and that's something that we could do also. We have a lot of people, all the representatives in Berkshire County have sponsored a bill that would make Massachusetts have a single-payer system. We just have to get the leadership to take a vote on it and get it passed. But on the issue of health care, I was looking, and I showed you before this headline. It was in the Berkshire Eagle on Friday, October 13th. And the one I'm looking at here is, why doesn't Fairview have an MRI? So the Berkshire Eagle put it right on the front page. The lack of diagnostics tools meant a long road to care for a local businessman. And there's a long article about how Eric Bruin, who is the CEO of Sofo Creamery in Great Barrington, lacked an MRI machine at Fairview meant he only learned to be having strokes is after his 22-mile trip to Berkshire Medical Center. And they said how unjust it is, and it went on for a couple pages. And I think it's great that the Berkshire Eagle is covering this issue. I hope that they would cover later the fact that in Berkshire County, there is a maternity ward in Pittsfield, and there's a maternity ward in Great Barrington, but there's no maternity ward here in North Adams, and nor is there a plan to have one when they reopen the hospital. So I know the CEO had a hard time getting
there.
from Great Barrington to Pittsfield, but let's think of all the mothers who live in the outlying areas here in the North Berkshire. They have to travel more than 22 minutes to get to Berkshire Health Systems. And we know from the records of the ambulance service that there have been over 125 calls since 2017 related to pregnancies where they called the ambulance to come help transport a mother, sometimes arriving after the baby was born. So I'm glad that they're talking about that issue of unfair treatment or lack of equal access to care in South County, and I hope they continue to do it, talking about the lack of care here in North County. We've experienced that for over 10 years, or almost close to 10 years now.
You know, a complicated birth, I think. You're talking about not just the child, but you're talking about the mother's life also. And traveled that long distance. I mean, from my own experience, having twins, I mean, I was in dire straits in the hospital. And I was in the hospital, and my blood pressure was going down, and my son's heart rate was going down. And if I had to ride 45 minutes to a hospital to get there, I don't think that I would have made it. So, and just regular births also, I'm saying too, but I'm just saying the complicated ones are, you need a birthing center here, you know, to take care of these women that deserve it.
Yeah. Michael, you talked about transportation. I mean, this CEO had a drive from Great Barrington to Pittsfield for that MRI, but he probably had access to a vehicle and transportation to get there. And you're saying there's a lot of people in North County and probably some in South County that don't have access to transportation.
They don't. You hope to find people you know pretty well and have to call them up, as you know, to get a ride.
Yeah.
And the only thing they can do is, it seems like people, before it used to be doctors taking care of people, the big organizations, and now it's that the people have to take care of each other more than ever. And come on, folks, it should be getting better, not worse.
Right. And then also in this paper, on the same day, there was an article just below it about visiting nurses to resume full service. Berkshire visiting nurses will resume full service throughout the county on Monday, according to a Wednesday statement from the Berkshire Health System spokesman Mike Leary. The Berkshire Visiting Nurses Association will begin seeing new patients from a group of 15 Berkshire County towns, primarily from South County, that it has previously suspended accepting patients from as part of the service reduction. But there are some in North County also. The lifting of these temporary restrictions was made possible by the series of recent hires to Berkshire's VNA team, Leary said. As BHS continues facing a nationwide staffing shortage, we remain focused on recruiting top talent and making the decisions that will ensure that all residents of Berkshire County have access to high-quality care today and tomorrow. Then it goes on page 5, because I think it should have been on the front page, but it starts talking about the union. But see if I can find that here. In July, the BVNA shrunk its services area due to staffing challenges and said new patients would no longer be accepted from 15 towns, primarily in South County. It cited significant changes in staffing at all levels for that service area. And the union, though, has come out with a statement. Tamara Collins, a union co-chair for physical therapists at VHS, estimates based on the resources provided to the union staff in the spring of 2021 that the South County team had 232 hours of committed staff for a month. At that point, there were no traveling staff members. In June 2023, South County had 200 hours with 3 committed staff and 2 travelers. In August of this year, they have now 120 hours with 3 travelers and no committed staff. The BVNA said that productivity and caseload expectations set by the administration are untenable and that the current pay scale for clinicians don't represent a living wage. In theory, the new hires could help address some of these issues. But Caldas said Thursday that she and her colleagues agree it is good that the services are reopened, but they said that based on the stopgap measure and retention problems haven't been solved since the majority of the new hires are traveling nurses. We never wanted them to have to lose services, but we could see that this is where it was going. So we're trying to get changes in place to prevent this from happening, Caldas said of the impetus for forming a union. We know how important the VNA is to our community, and that's why we keep trying to push for this contract. Our goal with this contract is to get not travelers, but permanent staff in place to be able to retain them. The majority of our staff leaves within a few months, Caldas said. So the issue is they're not being paid enough. That's why they're not staffing. You know, so you have to pay the workers enough so they don't want to go somewhere else.
Exactly.
And it's, everyone agrees we need the VNA. I know people, you know people
Yeah, I
that
work
need
for
the VNA. We need it to be staffed. And when it's hard to find staff, what you do is you pay them at a living wage and they'll probably stay there.
Exactly.
Me,
The thought of, you did read there about Dick, physical therapists also. I
Yeah.
have 2 people that I take care of that are shut-ins. And one lady, she has been waiting 6 months at least that long and keeps asking me, when are the physical therapists going to come? So but there's a lot of things that I see, like another fellow that I take care of who's in a wheelchair, who used to get his legs wrapped. But the people that used to wrap them didn't have the qualifications, so they couldn't wrap the legs anymore. And so who was going to do this? The VNA, and nothing's happened. So what happens? He gets something on his leg, and where does he go? To the hospital, to the wound center, which is going to cost more money. But if the visiting nurse was there, that would have saved, like we were seeing in Bernie Sanders there, that the cost of prevention is the thing that will save us from spending so much money. It's prevention. I believe in prevention. 100%.
it's true. An ounce of prevention is worth a pound of cure. Isn't that what the statement, what they've always said?
And you know, as a matter of fact, when the virus first hit, I wore a mask, and everybody else did. And then after a while, they didn't. I don't wear a mask today, but I never took off my mask. Even when I went in the pool, I never took off my mask. And when at the YMCA, the children weren't wearing masks again, and I said, well, at the nursing home, they just had an outbreak, and they live right next to, it's right next to the YMCA. And so the staff knew about it, and finally the heads of the YMCA, and the next time I was there, guess what? The children had their masks on. It's prevention.
Very good.
That's good. There was another issue that I wanted to just talk about briefly. We don't have enough time, but I listen to a lot of podcasts, and I want to recommend to you to listen to the podcast Pod Save the World. And it has a special issue that just came out a couple days ago. It's called Israel Tells Civilians in Gaza to Evacuate. And what it's talking about is the developing situation in Gaza, where 1.1 million people have been told to evacuate northern Gaza in advance of an anticipated invasion by Israel. They have, on this podcast, they have 2 people on the ground in Gaza that explain the logistical obstacles to evacuation and why many civilians have refused to leave. But in that podcast, Ben and Tommy talk about how when they were younger, they lived in New York during 9/11, and that spurred them to get involved in government and try to solve problems of conflict. But they said they wish that, during that period, the attack on 9/11, someone had a reasonable voice to tell the Americans jumping into a war with Afghanistan wasn't going to solve the problems of those terrorists that killed the people on the airplane. And he wished that, we didn't go through that trauma of a 20-year war in Afghanistan and a war in Iraq, and where we lost Michael DeMarsico here from North Adams. His father worked at the hospital and now works at the college. And now 20 years later, where are we? We've withdrawn from Afghanistan, and the same people are in power that used to be in power in Afghanistan. So it's horrible what those Hamas killers did, the unspeakable things to the defenseless Israeli citizens, that they weren't soldiers, they weren't policemen, they were just citizens, and unspeakable things happened to them. But when you get into that situation, the cry for revenge, sometimes it lashes out at people who weren't guilty of the crime. And that's what happened in the United States. I always believed those people driving those airplanes, flying those airplanes, were guilty, and the people that helped them. But the entire population of Afghanistan wasn't guilty of that. They didn't even probably know about it, So we hope and pray for everyone there that we just remember that everybody is a human being, that
Right.
everyone wants their children to be safe and free, and the only response we can have to hatred is compassion
Exactly.
and love. And but Israel has the right to defend itself, but we need to support cooler heads. And so let's bring
Let's
power
not
to the
have
people.
war. Let's
Power
not
to the
have
people.
war.
Right about that.
Peace.
It's a tough one.
I hope I handled it okay.
There's power in the factory, power in the land, power in the hand of the worker. But it all amounts to nothing if together we don't stand. There is power in our union. Now the lessons of the past were all learned with workers' blood. The strikes of the bosses we must pay for. From the cities and the farmlands to trenches full